As we've mentioned, COVID cases are rising in all 50 states. According to the CDC, more than 64,000 new infections were reported Friday. 49% of the country's total population is fully vaccinated. So far, that's not enough to contain the virus. Alexander Tin joins me now. He is a CBS News reporter covering COVID-19. Hi there, Alex. Good to see you again. So vaccines in the U.S. are only approved for emergency use, which prevents institutions from being able to mandate them. So how are businesses and organizations handling that as they try to reopen?
Well, yeah, let's be clear about two definitions here, right? So number one is the question of what does it mean to be prevented from requiring a COVID-19 vaccination? We know that both in federal law and in the majority of states, businesses and institutions are perfectly legally allowed to require COVID-19 vaccines right now of their employees and even potentially of their customers or their users. But we also know that there is significant hesitancy around organizations and institutions and businesses doing this before these vaccines have gotten a so-called biologics license application. That's what we, colloquially call as full approval of these COVID-19 vaccines. Now, to be clear, these vaccines are safe and effective. We've seen time and time again, there's more data now than we would typically have before a so-called full approval of any drug, any medicine, let alone a COVID-19 vaccine, that they are safe and effective. What we don't have, and what is kind of the dotting of the I's and the crossing of the T's that the FDA is doing right now for the applications before them from Pfizer and Moderna, is much more related to things like manufacturing and compliance, things that they are statutorily required to do before they can grant approval for these vaccines to make sure that long after everyone cares about COVID-19 vaccines, that the processes that are being used to make these vaccines, the factories, the workers, the, what have you, are all going according to plan, are all being done safely and effectively with lots of safeguards, right? So while they're dotting those I's and crossing those T's around manufacturing, there are a lot of these institutions that don't feel that they can require them right now, even though, again, we know that they're safe and effective. And so you've heard a number of businesses and institutions say, well, we will require COVID-19 vaccines, or we will consider requiring it, but only after they get full approval and if it's effectively tied their hands in that way. Now, on the government side, as you've heard in that story that aired just before us, there were a handful of city and local and state governments that are considering or have already said we are going to require at least some of our employees to get vaccinated or have to face a certain kind of COVID-19 testing requirement. And we heard today that at the federal level, the VA is going to require their healthcare workers to get a COVID-19 vaccine. So again, yes, it is true that the so-called lack of a BLA or full approval of these vaccines is preventing some institutions and some businesses from requiring COVID-19 vaccines, but that's in most cases not a legal requirement that's blocking them. It's really a mixture of what they've said publicly and what the public has told them.
Interesting. Well, over 50 medical groups are calling for mandatory vaccinations for healthcare workers. What is behind this request now, and what do we know about healthcare workers' rates of vaccination compared to the rest of the population?
Yeah, well, writ large, we don't have great data on all healthcare workers. We've seen surveys that have come out both from these professional associations like the American Medical Association or the public health organizations that were behind that call today saying we want healthcare employers, we want long-term care facility employers like nursing homes or hospice care to require their employees to get vaccinated. And you saw them pointing both to anecdotal cases, but also some of that survey data that suggests not only are there large shares of these healthcare workers that are unvaccinated, but also that some of them are potentially bringing COVID-19 cases into these places, into places where people are vulnerable and potentially, even if they do receive the vaccine, not mounting the same kind of antibody immune response that you or I or another healthy person might get from a COVID-19 vaccine. And so that was really the motivating push that we heard from the authors behind this kind of effort to encourage employers to require COVID-19 vaccines. Now, we do know that we are going to get some better data on this soon. We already have from CMS, that's the federal agency that regulates nursing homes. They already published data that's reported to them of vaccinations among staff in nursing homes. And, just to put it bluntly, in many, many states, that average is at least below the average of adults in other parts of the state. And we also know that in October, hospitals are going to have to start reporting these figures too. And so by then, we will probably have a lot better idea of how big this gap is.
Well, Alex, the Delta variant is currently the dominant strain in the U.S., but it is not the only one of concern. What can you tell us about some of the other variants being studied?
Well, how long do you have? No, but anyway, let's just pick two variants, right? One which was concerning before the Delta variant and one that is potentially going to be concerning after. You know, we heard from public health officials for months before the emergence of the Delta variant that they were very concerned about something that's called the P1 variant or the Gamma variant that was first spotted in South America. And the reason that was concerning, and we've heard more data from this since, is that the Gamma variant or the P1 variant not only appeared to be potentially spreading faster or causing, worse symptoms in some people, but that it was linked to potential vaccine breakthrough outbreaks among, say, for example, minors in French territory in South America, where a large number of minors who were all fully vaccinated with the COVID-19 vaccine were potentially sickened and got some symptoms from this so-called Gamma variant. Now, at the moment, the Gamma variant seems to have been dramatically outpaced in the United States by Delta. But obviously, as more and more people get vaccinated, that is going to continue to be a concern. And another variant looking towards the future that we've heard from federal public health officials is the so-called Lambda variant. That was also spotted first in South America and has been spotted spreading in some other places with large populations of fully vaccinated people. Now, again, this is still, according to the CDC, a very, very small percentage of cases in the United States, although it has been spotted here in the United States. And at the time, there's no hard data suggesting that this variant is, somehow evading the vaccines or evading the treatments that we have for COVID-19. But again, if we had to pick just two to watch out for, it would be the Gamma variant and the Lambda variant as things that public health officials have told us they're watching very closely.
Yeah, I mean, Alex, that's the first I'm hearing of the Gamma variant specifically with respect to minors, to children and young people. That's something.
I'm sorry, I meant to say minors, like mining in a cave, for example, not children.
Oh,
I'm sorry.
Minors. Okay,
Yeah,
thank you for that clarification. Still, no. I am glad we clarified. Minors in a cave. Okay, well, that's a very important thing nonetheless. So CBS News reporter Alex Tin, thank you for that clarification and for covering all things COVID for us. We really appreciate it.
Thank you.